Hi everyone, I am Dr. Bhushan Parmar, consultant medical oncologist, ClearMedi Bahra Hospital, Mohali. Today I am going to talk about the mistakes that cost cancer patients time. First and foremost is diagnostic and communication delay. When the symptoms are very mild, patients tend to ignore them and they think that it's not that urgent to consult a doctor for these symptoms. They tend to ignore fatigue, weight loss, reduced appetite, and this allows the cancer to grow silently inside the body. Many symptoms of early cancer do not feel urgent to the patients, but this is the silent stage during which cancer can be detected by various sophisticated investigations, and this leads to a better outcome overall when the patient gets treatment. However, patients they tend to normalize these symptoms. If some symptom is stable, for example, if they have been feeling fatigue for the last 1 or 2 months or feeling that they are losing weight, they will not go to their doctor because they think that this somehow will be managed at home without any professional consultation. This is the biggest mistake patients make. Then next is the mistakes done by the patients during the cancer treatment. First of all, ignoring the complications of treatment, for example, severe vomiting, bleeding, any fever. Usually patients think that these are normal symptoms and do not report to the doctor. But any patient who is on chemotherapy and develops severe loose stools, any bleeding, fever with chills, they should immediately report to the doctor. Then coming to some unprofessional advices which are being circulated currently on this social media, for example, skipping meals. Skipping meals during chemotherapy or immunotherapy during the cancer treatment can be detrimental. It can lead to delayed body recovery and delayed chemotherapy and thus hamper the final outcomes of chemotherapy, and the results are not that good. Self-medications and starting various herbal supplements which are being advertised on various social media sites and without the permission of the treating doctor hamper the chemotherapy or immunotherapy outcomes. So patient is always advised to consult his treating physician before starting any kind of supplement, be it herbal or any other supplements. There are certain lifestyle modifications required during cancer chemotherapy. Because the patient's immunity is down, they should avoid socialization with those people who are having infections, cough, runny nose. Because this will, if they catch that virus, that will lead to delay in chemotherapy and thus the cancer treatment outcomes will be poor. If you or any of your relatives is undergoing cancer treatment or is suspected to have cancer, you can visit our hospital for the expert guidance.